Why buprenorphine for restless leg syndrome? I'm Dr. Andy Burkowski of ReLACS Health. So I'm going to take a few minutes to talk about buprenorphine, which is an opioid medication that really should be used more often in restless leg syndrome. Opioids are perhaps the oldest treatment for restless leg syndrome and are a necessary treatment even now for restless legs in individuals who have failed first-line treatments and have moderate to severe restless leg syndrome. Buprenorphine is what we call a partial agonist of the opioid receptor in the brain, so it has very strong chemical effects on the opioid system that help to relieve the symptoms of restless leg syndrome, but it has some advantages over other classic opioids. And one of the main differences is that buprenorphine has fewer side effects. So the types of buprenorphine that are available, it comes in many different forms. In a patch form, one of the brands is called Butrans patch. It can be placed under the tongue and dissolved. One of them is called Suboxone. And then there's one that goes up against the cheek called Belbuca. Buprenorphine cannot be swallowed as a tablet, so it has to get into the body through one of these methods. The biggest benefit of buprenorphine over other opioids is that in most cases, it prevents what we call respiratory depression. So there are tens of thousands of opioid-related deaths every year in the United States, and that's due to an overdose causing a person to stop breathing. Buprenorphine, because it's a partial opioid agonist and not a full opioid agonist like most other opioids, does not seem to cause respiratory depression unless it's combined with other drugs that do similar things. The other advantage of buprenorphine is that there's no euphoria, so people typically don't get high off of buprenorphine, and therefore it's much less likely to become a drug of addiction or abuse. In fact, it is becoming the main opioid medication to switch people to from other opioids that are being abused or people who have opioid addiction or dependence. So these are the advantages. The drug is also a longer acting drug, so its half-life is upwards of 24 to 48 hours, meaning that 50% of the drug is eliminated by the body in a period of 1 to 2 days. So if an individual takes the medication once or twice a day, after 4 or 5 days, the level starts to build up, and it provides consistent and stable relief of restless leg syndrome. So it's a long-acting drug like methadone, which is much more commonly used in restless leg syndrome, but it seems to lack some of the negative side effects that could occur more likely with other opioids. Yes, it does have the same potential risks as opioids, but it seems to be safer. So much so that the DEA has made it a Schedule 3 opioid, meaning it's less highly regulated than other drugs more commonly used like methadone or oxycodone. Some colleagues at the Cleveland Clinic have been working with me on a study that looks at 55 patients that were prescribed buprenorphine for severe restless leg syndrome. And in this study, at the time of this recording, it is not yet published, but let me give you a quick preview. Of these 55 patients, about a quarter discontinued either due to insurance reasons or side effects, usually dizziness or some degree of impairment from the drug, but 3/4 of them tolerated it long term, up to the point of about two years in length of the study. And all of these patients went from a severe level of restless leg syndrome down to a mild to moderate level. Their insomnia improved, their daytime sleepiness improved, and a lot of quality of life measures all improved on this medication. Of this group of 55, a significant number, the vast majority, had augmentation with dopamine agonists, and 84% were able to eliminate their dopamine agonists, and 14% had reduced their dose at the time of the conclusion of this study. So hopefully this comes out and gets published, but this is good medical information that will show that help support the use of opioids for moderate to severe cases of restless leg syndrome, and now a potentially safer and less risky alternative in the form of buprenorphine over other opioids. As always, and in particular in the case of opioids, this is for general medical information only. It does not constitute medical advice or the practice of medicine. All healthcare decisions should be made in conjunction with a licensed medical professional. And remember, the key to sleeping well is to relax.